Hi, I'm Kelly, and I wanted to make this little video to share with you about how I came about finding out my diagnosis for trigeminal neuralgia. It's been a little bit of a process, I have to say. It all started several months ago when I went to wash my face. And as I washed across my forehead and just barely touched with the wash rag, touched, I guess, the nerve up there. I don't know, well, it was the nerve. And it shot pain through my eye and down in my teeth. And I thought, what the heck just happened? I did not touch an electrical socket. I looked around to make sure there's nothing going on there. And I just thought, okay, that was crazy. That hurt and that was crazy. I remember going in and telling my husband, I just had this horrible pain shoot through my head and face. It doesn't even make sense. I don't even know what could cause that. So blew it off. The next day I'm doing something and I touch my forehead. Same thing happened. It shoots pain through. It's like an electrical stabbing pain in your face. And I can only explain, like I kept telling people, it just feels like I'm touching a socket. Electrical socket, and it's just shooting pain through my head. The only thing I can think of is, well, heck, maybe I have a sinus infection and it's just a lot of inflammation in there and it's causing some weird pains to go off. So I call the doctor and get in, and I'm prone to sinus infections, so I tell them, okay, I'm having a sinus infection. This pressure's in my jaw and in my ear. I can feel in my ear and my eye, and I'm like, well, doesn't look like it. There's a little bit of redness there. Maybe you are, So I get an antibiotic, start on that. I feel like it's helping some, and the shocking doesn't go away, but it feels like the pressure is going away in my jaw a little bit and in my ear. And I think, well, maybe this is going to work. A couple weeks go by, it's still there. I called the doctor again. I'm like, okay, this is in my jaw. I've got some kind of infection in my bone and it won't go away, and it's causing a lot of pain in my face. So they call in a stronger antibiotic. Again, it feels like it's going to help a little bit. Maybe in my mind it's helping, I don't know, but it felt like it was helping me some, relieving some pressure off my face and ear. So I take that, finish that round, and I'm like, it is still there. Okay, never have I had an infection last this long or hurt this bad. I don't know what's going on. I start researching on the internet, shocking pain in your face, and I start finding a little bit of information out there on something called trigeminal neuralgia, and I'm like, okay, I've never heard this ever. Is this even real? There's so many things out there that's not on the internet, and you Google search, you can diagnose yourself with almost anything. So I think, well, maybe this is it. Well, I know I have a dental appointment coming up, and I'm thinking, I don't know if I can even go through that. The pain is so bad that if they hit the wrong spot, I'm going to just shock and jump off the table or off the chair. So I go to my dentist appointment and I tell them, okay, hey, I'm having this weird pain. It's shooting through my whole head and face. We can try this, see if we can make it through that, because I had a feeling to go through. Well, they can do the feeling. It doesn't affect hardly anything. I sit there, I don't wiggle too much, I don't smile too much, because what was happening, if I moved too much, if the wind blew my hair across my forehead, it would shoot the pain through. If I moved my eye too much, squinted, the sun hit me, I would have the shocking pain go through. If I turned wrong and laid on the pillow sideways and it hit a certain spot, pain would shoot through my eye. And I'm thinking, okay, I'm going to go blind, or my teeth are going to fall out. Something is going on. This hurts so bad that there's no way my teeth can survive this, or my eye. So the dentist sends me to an endodontist, to check out all my teeth. I have them all checked out, and I tell him what's going on, And I knew it wasn't my teeth. I mean, the pain is coming from the head shooting down versus teeth going up. And I'm like, okay, if it was my teeth, pretty sure when I bit on something, it would shoot the pain through. I've had that pain before. And the orthodontist said, you know, I've seen this before with a couple patients, and they were diagnosed with what's called trigeminal neuralgia. And I'm like, okay, maybe that's it. So I start researching what that is, and the symptoms sound exactly like what I have. And I'm thinking, okay, and you look on there in most places like, okay, it never goes away, you're going to be stuck with this for life. It's pretty depressing, and knowing that I can't do certain things, it was hurting so bad. I would play the grandchildren and jump or twist a certain way, and that pain would shoot through, and they would like, are you okay, Nina? What's going on? I'm like, nothing, it's okay. Just some pain there. But it was excruciating. It was enough that just stopped you when it happened. You felt like you were being electrocuted. So I make an appointment with my doctor again. And I go in and I'm like, okay, this is what's going on. And I was kind of embarrassed because I'm like, it's crazy. This is a weird thing going on. And I tell her the pains that I'm having and where they're coming from, and that nothing else has changed in my life but that. There's just, all of a sudden, this pain has just started. And she said, I think I know what you have. And she was able to go get a neurologist to come in and visit with me. And after he visited with me, he said, you have a sure case. There's no doubt in his mind. He said, you have trigeminal neuralgia. And there's sometimes no reason. It just starts. It starts in middle-aged women and men, but more likely women have it. You know, and like 12 in 100,000, lucky me, are diagnosed with the pain. So from there, they prescribe medication, and it's pretty strong medication. I was given carbamazepine, I think is how you say it. And first, just 200 milligrams. I start taking that, and I'll ask how quick does it work, and they're like, it's pretty fast. So I go home, I take that, and it makes me so tired. It makes me so sleepy. Makes me kind of like a whatever mood. I didn't care a whole lot, but it was helping. It was making me feel better. So that 200 milligram, I was like, okay, there's relief. At least it's not stopping me in my tracks. I was still having it. I could still feel it, but it wasn't as extreme. It wasn't a number 11. I mean, I remember saying, okay, if this is a pain scale, this is an 11. And I'm pretty good on the pain scale thing. So I go back in 2 weeks, and she's like, okay, how's it going? I'm like, it's tolerable. I can deal with it better than I can. She goes, well, I don't want you just to deal with it. We want to try to take care of it. So they upped the medication to 400 milligrams a day. And then it's working much better. I'm more tired. I'm not driving now because I'm so dizzy. My balance is off a little bit, but there's still some pain there. And she's like, I don't want you to feel the pain at all. I want you to wake up and not have to worry about that pain that's going on. And I'm like, yeah, I did too. But so we go up to 800 milligrams a day, which helped. It helped a lot. And so I was feeling a lot less pain, a lot less pressure in my face. The burn is not there as much. The pressure in my ear is still there, but it's not as much. The shooting pain through my eye socket, I feel like my eyeballs might survive now. My teeth might stay into my jaw there. But it's not a good way to live. This medication is for mainly like bipolar patients, things like that. So it's not the best medication you can be on. But my body's adjusting to it, and I'm trying to deal with it, and I'm trying to stay active with my family and my grandchildren. But it's debilitating me to a great extent. So later we go to the doctor again for a follow-up because she's keeping close tabs on me, which is good. And she tells me that she has come across a CyberKnife institution in Tulsa. It's mainly for cancer patients, but they're doing some therapy for patients with trigeminal neuralgia. And she wants to refer me to that, and I'm willing to go. I want some relief, I want a better life. So I go there, and about 15 minutes into the visit, the doctor's like, I can diagnose you right now. That's what you have. If you would like to try radiotherapy, you're a good candidate for it. If you want to do the cyber surgery, you would be a good candidate, and we could get you off a lot of your medications. Maybe not all of it, but most of it. Would you be interested? And I'm like, yes, I think I would. I want to be able to function. So we go through the MRIs, the CT scans, everything to make sure there's no tumor, one thing, and then there's not. And then to get good diagnostics, good pictures on where the trigeminal nerve is at. They make a face type mask that's going to fit over me when I go into the surgery to keep me from moving any, which is important. Now keep in mind, this has been a process of several months going on, and I started in like October of last year, and in January, February, the doctor down here, my doctor, diagnosed me. March, April, it's May now, and I get officially diagnosed at the CyberKnife Center. Go through the MRI, CT scans, etc. And then here it is, June, July, and then August, I have the surgery. And this is a radiation therapy to the central nervous system, or the fifth cranial nerve. So they did radiation straight through. I could feel it as they scheduled me for that. I'm nervous but excited at the same time. You have to lay very still. The radiation therapy targets the specific nerves that it needs to help, I'm going to say, damage those nerves where they are not as sensitive, and you will not feel the pain going through. This has only been a week since I've had that done. I still have the pressure. I'm still on the medication, so the medication's keeping the pain from being there, first of all, and so I will wean off of that. You're not supposed to just cold turkey that kind of medication, but I can still feel some pressure in the ear, in the face, and through the forehead. I can feel the pressure. I'm not feeling the shocking pains, so I'm hoping that as I am able to wean off this medication, that I will only feel the pressure maybe and not those shocking pains, and it's going to work. So hopefully with the CyberKnife surgery that I will be back to my old self pretty soon. So I hope this helps. Thank you.